Your prescription saved you but could cause harm to someone else. Many people tend to share their prescription medicine with their friends, their relatives, their colleagues, or even their neighbors, thinking they are helping. But in reality, sharing your prescription medication is unsafe because it could lead to potentially life-threatening conditions or situations. When we talk about prescription drugs, we are talking about medicine that are prescribed by licensed healthcare practitioners like pharmacists or doctors. And these prescriptions, they are tailored to a specific person, and it is based on diagnosis, weight, current medical condition, and medical history. So it is not a one-size-fits-all thing. One of the reasons why, or some of the reasons why some persons share their medications with their friends or family members is because they think they experience similar symptoms, and then they want to help that person save costs by because some persons feel that by giving them the medication, they've saved them the stress of getting to see a medical doctor or a pharmacist, and as such, they give them the medication to take. And so they think they are helping them to save costs, but in reality, that's not what they are doing because a safe dose for one could be a toxic dose for another person. Now, there are dangers that are involved when you share your prescription medications with another person. When you look at it closely, is that when you went to get your prescription medications, you were asked a lot of questions, you were asked to run some tests and all that, and you followed through that protocol and you were able to arrive at the suitable drug for you. But for this person, what happens is that there's a wrong diagnosis because similar symptoms could mean different things. The organism or whatever is causing that problem might not be the same. So it could lead to wrong diagnosis and then it could worsen the other person's condition. Another thing is inaccurate doses. Now, doses varies based on age, weight, and other criterias. And your the criteria you fit into might be different from this person's criteria. Your weight might not be the same, your age might not be the same. And that thing is that the duration, because you've taken out of those drugs, the drug might not be complete. So if it's an antibiotics now, the rate of increasing antibiotic resistance has increased. So another thing is the person might be allergic to that particular drug. So imagine giving somebody a drug thinking you're helping that person. Unknowingly, you are actually harming that person because if the person is allergic to that drug, you've worsened the person's condition. And another thing is you are worsening that person's condition in the sense that the person might get temporary relief from that drug you've given that person because the drug has masked, whatever disease it has, delayed the reaction time of or whatever condition that person is facing, and before you know it, the person breaks down. So before you think you are helping that person, or the best way you can even help that person is to educate the person as to why the person needs to go and go to a doctor or to the hospital to run some tests, get checked, and then you have to advise the person on why this is important, because giving that person the drug is not you helping, but educating the person on the needs to why he or she needs to get properly treated is the best thing you can do for that person. Thank you. So if you find this video helpful, don't forget to like, share, and subscribe for more.